Namaskar. I'm Dr. Sunita Devi, Assistant Professor in Rehabilitation Psychology. Today, we will talk about core conditions of counseling and some basic counseling skills. So, when we talk about core conditions of counseling, there are certain main or core conditions which are important for creating the therapeutic climate, which will help in client sharing and working towards changes or situation. So, if we do not have these core conditions, it will hamper the therapeutic process. So, in the absence of this therapeutic atmosphere, counseling or psychotherapy will not be effective. So, in order to make it effective, these core conditions are required, which are trust, acceptance, genuineness, unconditional positive regard, and empathy. Let's talk about trust. Trust is the basic foundation of life. If you have studied Erik Erikson's theory, the first stage of life is called trust versus mistrust. And the virtue they develop in this age is hope. Creating a trusting and safe environment so that the client feel assured enough to share his or her thoughts and feelings. He feel safe, he feel trusted, he can share the feelings and the situation without any hesitation, without any fear of evaluation or judgment. The client is in the state of anxiety and disturbed feeling, and that's why they are coming for counseling. So with lack of confidence and trust, they are coming in the counseling session. This should be established in the first session itself. So counseling has a process. So in the initial session only, the environment of the trust has to be developed by counselor. So when clients perceive the counselor as trustworthy, they will take greater emotional risk of expressing their inner anxieties, worries and fears. The more they express, better we can understand them, and this increases the chance of therapy success. Another core condition of counseling is acceptance. The client has come to the counseling or therapy situation feeling rejected, devalued, abandoned of his or her perception, feeling and values, because in society we do not get acceptance, sometimes not even from our near and dear ones. So counselor conveys to the client a sense of acceptance irrespective of the client's views, behaviors and action. We do not discard their views. We do not say, oh, you are not saying right, it is wrong, it should not be done in this way. Because every view and behavior and action should be listened to and accepted to. We have differences, and once you understand and accept the client starts sharing what he is going through. So the client is accepted as he or she is without any judgment or criticism, and this conveys the sense of respect for the client as an individual. Trust and acceptance are starting points of any counseling relationship. Another core condition which is very, very important in counseling is unconditional positive regard. The counselor or therapist has positive regard or respect for the client, which should not be based on any condition. Mostly we put condition: if you will do this, you will be loved. If you do this, we will listen to you. If you will not do this, you will not get this. Lots of conditions we put on people. So when the client is coming in the therapy, as a therapist, it's very important to create that environment of unconditional positive regard where the client is accepted and respected for who is, what he or she is. And there are no conditions put on the relationship. The counselor accepts the client in totality and in complete who they are. Unconditional positive regard communicates caring, worth, and dignity to the client, and this concept of unconditional positive regard was given by Carl Rogers in 1957. And it is an attitude of valuing the client as a unique and worthwhile person. No matter what he has done, no matter what he is thinking, he is still worthy of unconditional positive regard. And that's what the core condition we counselor or psychologist should create in counseling session. Being respected for without any condition or judgment attached frees the individual and open up possibility of change within the individual. Another core condition which we will talk about is genuineness or authentic, being authentic. It refers to being genuine or real about who we are. The counselor or the therapist comes across to the client as being a person who is genuine, who is interested in the client's welfare. It's not because the counselee is coming from a very reputed background, or he is very having a very authority or high position, so we give more interest. No, any counselee, any person who is coming for counseling, irrespective of their caste, creed, their gender, when we are interested genuinely in the client feel comfortable, the client feel sharing what they are going through. So he or she does not put up any mask or any facade. And this is crucial to create trustworthy relationship in therapy. The counselor also needs to be congruent with his or her feelings. So when we say congruent, means what I'm thinking the same way I'm saying. Suppose if the client, you feel that, oh, this person is very cunning. If you're thinking this and you're saying, no, 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 you're a very good human being, the authenticity will not come, because the congruency in the thought and in your, communication was not there. So in order to be genuine and authentic, there has to be consistency and the balance or the congruency between what you are feeling, what you are thinking, and what you are saying. And it should reflect in our attitude at that particular moment. There is a consistency in the counselor's words, actions, and feelings. Such transparency helps the counselor to encourage the client to get in touch with his or her own real feeling. They start also becoming genuine and authentic with themselves and with their feeling. And another important core condition of counseling is empathy. When the counselor or the therapist is able to show empathy towards the client by experiencing the client's world as he or she is experiencing it, what they are going through, how they are going through, what kind of emotions they are going through. So that empathetic relationship will communicate a real understanding of the client situation, thus fostering trust in the client. So these are some of the core conditions of counseling which are very, very important for creating a therapeutic relationship, building a therapeutic relationship. If we do not have these 5 core conditions of being having acceptance, having empathy, positive regard, if we do not have this, the counseling process may hamper, and the counselee may not be able to share what they want to share. So in initial session of counseling, these core conditions are important for counselors to create so that the client can come and share their difficulties and can go with the therapeutic healing. So apart from these core conditions, there are basic counseling skills which every counselor, every therapist must acquire. And the success of entire counseling process depends on the use of these counseling skills by the counselor or therapist. Right from the beginning of building up a rapport building is very important. So when we say rapport building, it is basically creating that trustworthy environment with the client, so client feel comfortable to share. So if you have a good rapport with the client, the person feels comfortable physically, psychologically, emotionally safe to share their feelings. So building up rapport with the client till the termination of the counseling, the counselor or psychotherapist needs to use various counseling skills in an effective manner in order to have a better counseling process. So let's work on attending skill. What is attending skill? Suppose if someone comes to your home, You leave everything, you leave the phone or you leave what you are doing and you attend the person physically. You pay attention to him or you listen to him. You ask them to come and sit and offer some tea or coffee or, ask how is the day and all. So you leave everything and you attend. So attending skills are important through the entire process of counseling. However, this is very important in the initial stages of counseling where the client is creating trust and acceptance. Attending skills also help in conveying genuineness and empathy, and client feel that yes, you are genuinely interested in listening to his or her difficulties and you are having empathy. So by attending skills, that is conveyed to the client. Attending means focusing on the client and concentrating on what he or she is telling and not busy with your writing, busy with or fumbling with the words or playing with the mobile or playing with your ring or your, anything, your clothes and all. So it's leaving everything and focusing on the client. Attentiveness can be both verbal and non-verbal. So when we say verbal, where you start showing, yes, what you are saying, can you repeat it again? Can you just elaborate on that? So these can be verbal attending. Non-verbal is nodding your head, saying, carry on, yes. So making an eye contact, and by using the non-verbal communication, you can attend the client. So there are basic solar technique which is for attending skills. So these solar technique will help you to become better in attending. So S is for squarely face the person. So when you are in the counseling session, when the client is coming in the counseling room, first face the person and ask the person to have the seat, and it should be comfortable where the client can be comfortably seated. Open O for open posture. You know, as a counselor, you should not cross your arms, you should not cross your legs, and you should be open, having the open posture, hands on your side on the or on the armrest of the chair. It shows that you are ready to listen what the client is sharing. If you have crossed arms or crossed leg, it shows non-verbally, it shows or convey to the client that the counselor is not open. So counselor should display the open posture. Client can sit whatever the way they want to sit, but the counselor should have open posture. Then lean towards the speaker. So if you are sitting on the chair with the backrest and little leaning backward, it shows I'm not interested in what you are saying. So as a counselor, if you are attending the client, leaning towards the speaker is important. That shows that I'm interested in what you are saying. But too much leaning also can disturb the therapeutic relationship. So you should lean forward, but not too much or not too less. Then making an eye contact, because eyes are the window of your soul. Whatever you are saying, if you are making an eye contact, you will feel comfortable. But eye contact does not mean staring at the person without any blinking and just focusing on what, on his face, and that makes the person uncomfortable. Eye contact means brief looking at the person, and if he is fumbling with the pen or pencil or observing the person, and whenever he looks at you, you look at the person and make an eye contact. R is for relax. This is for the counselor. So if the counselor is not relaxed, if they are anxious, if they are not knowing what they are doing and they are worried about the counseling process, that get conveyed through the body language of the counselor. So as a counselor, it's very important that you relax, because that builds the confidence in the client that, okay, I have come to a place where I can get help. Because if you as a counselor is anxious and worried, they lose the trust. Client lose the trust in you. So relaxation is for counselor is important when they are talking to the client. So this is the solar technique which we use in attending the client, and developing these skills are important for counselor. Another important basic counseling skill is active listening. Listening is much more than simple hearing. That's why we are not using you should hear what the client is saying. We always say you should listen what the client is saying. And active listening means listening with the real understanding and paying attention not only to the word but also to the client's thoughts, behavior, and feelings. Not only what he has said, why did he say this, what is the intent behind it, what is the thought behind it. So, understanding the meaning which is not even conveyed, reading within the words, listening within the lines. So, that is called active listening. The counselor is not distracted and does not judge what the client is saying. And this helps the client to feel understood and validated. Because if someone is listening, today's problem is this: no one is having time for anyone, no one is ready to listen, everyone is listening to respond. What you are saying, I have to respond or I have to answer that. Active listening means complete attentive listening to what the person is saying, not only to what he is saying, to his verbal and non-verbal behavior, thoughts, and attitude. And by this, you are saying that you are important for me and I'm ready to listen without any judgment, and you feel understood and validated. And this also reflects the client's state of mind accurately. Active listening or attentive listening is required through the entire process of counseling, and it enables the counselor to respond back to the client in a way which makes communication between the client and counselor more open and effective. So active listening is not only required in initial session where attending skill also required throughout, but initially to build a rapport it is much more required. But active listening is required throughout the counseling session, initial stage, middle stage, and the last stage of the counseling. So there are certain barriers to communication which the counselor needs to keep in mind. So when we are attentive, when we are listening to the person, and listening also is communicating, giving advice. Counselors are not supposed to give advice because what the client is going through in his or her life, you cannot understand that. The person can understand with whom they are talking, how is that person, what they will understand or not. So, giving advice is a strict no in counseling. We do not give advice. We help the person, okay, if you will do this, what will be the consequence? If you will do this, what will be the consequence? Now you decide what will be better in your context or your situation. Always believe that the client is having the capability and he has the potential to solve his problems. He needs only the mirroring, empathy, and that positive, no unconditional positive regard environment where he can come and share without any feeling of judgment. So once that is there, he can take a decision, he can think through. So you help them, showing the mirroring, reflecting, and helping the person to take their own decision in life, and that decision how it can impact their life. So don't give advice, no advice giving. Then offering solution. Without listening only you offer solution. If someone comes and says, oh, I have a bad ache, a bad backache, you immediately say take one painkiller or do hot warming and put the hot pad and all those things without understanding what is the reason behind it. Did you sleep properly? So instead of offering the solution, ask, okay, I'm wondering what caused it. Did you sleep properly? No, I did not say that's why. Okay, it means you'll require rest. Okay, what else? So instead of offering solution, ask the person what solution he has tried, why it has caused, and how he is looking for solving this issue. Then preaching. Everyone preach, you should not do this, you should do this and all. No one wants to listen what we should do or not do. Everyone is capable of understanding what we are doing and what we are not doing. So preaching is a barrier to good counseling relationship. So no preaching in counseling. No judging or criticizing. You should not have done this. This is very wrong. This is criticizing. If you are criticizing, it means you have not accepted the person as they are. As we have already shared and discussed that every human being is they can make errors, and we have to forgive ourselves and forgive others for their errors as well. We have to be kind to self and others. So if you judge and criticize, you are unkind. So as a counselor, it's very important to keep in mind that you do not judge or criticize, do not preach, and praising and agreeing not to everything, but showing a mirror, okay, you would have done this, and see how it is impacting you. Now you take a decision. Reassuring is very important. Reassure the client what they are doing, and analyzing. So these are certain, if we analyze again and again, reassure again and again, these are the barriers to communication which a counselor needs to keep in mind. Then we have another important basic skill of counseling is paraphrasing and reflection. The counselor needs to listen to the client and respond appropriately. While responding, the counselor can focus on the content as well as the feeling of the client, and that is what the client says and how does he or she feels. So when we reflect on the thought content or the thought, then it is called paraphrasing. When we are reflecting on the feeling part, then it is called reflection. The skill to respond accurately to clients' thoughts and feelings enables the counselors to convey empathy. Oh, I understood. Oh, it must be very painful for you to go through with that feeling. Oh, it must be very difficult for you to bear that particular loss. So when you are reflecting, it seems you are very angry. I'm wondering what makes you angry. So when you paraphrase what the client is thinking and what you reflect on his or her feeling, it is conveying that I'm empathizing with you, I'm having empathetic listening, and what you are going through, I can understand. So that is a paraphrasing. So paraphrasing focuses on cognitive component of the client's message, while reflection focuses on the affective part or feeling part. It is not simply repeating back the client's words. So paraphrasing is not parroting. Paraphrasing is not like speaking like a parrot, the same sentences which the client has spoken about. Paraphrasing is focusing on the cognitive component and saying in your own words to understand whether you have understood the client clearly or not. On the other hand, the counselor rephrases the client's thoughts and feelings in a fresh way, and this gives feedback to the client that counselor is really trying to understand him, and this also helps the client to see things in a more focused way and can get a different perspective. So reflection is important to get different perspective and can help the client to focus in a better way. Then self-disclosure. This counseling skill basically refers to reveal things about yourself. If someone comes says, okay, when I joined a new job, there were so many issues and all, and you are dealing with the client. So you can say, yeah, I can completely relate with you, because when I joined as a counselor, I was very young and teachers never used to listen, and it must be very, not a nice feeling. You lose your confidence. It must be difficult. So when you are revealing about yourself, then the client is feeling, oh, it's not only me who can go through with this. There are people, and this is absolutely normal. I can have that kind of feeling. So self-disclosure helps the counselor come across as being genuine, and it also helps the client to see things in a less severe such a way. And this is there are others with the similar experience or the situation. That's what the self disclosure is. The only, however, you have to use a bit of caution that what to say and what not to disclose about yourself. So personal things should not be disclosed. They can be professional and non harmful things can be disclosed. The client should not have that feeling, oh, how she or he will help when she or he himself is having that particular trouble. Okay, so that bit of caution is important when you exercise self-disclosure, right? So it should not be too much as it may impact the professional relationship negatively, and it should not be like completely that you do not even genuinely share something with the. So self-disclosure, but with the caution. Then the skill of immediacy. So when we say immediacy, it helps the client and counselor become aware of the situation in counseling at the present moment. Right now, you have come to the counseling which is not working in spite of so much. So it seems now there's a deadlock. So when you are sharing or making the client aware about what is the situation right now, that is called immediacy. At times during the counseling process, there might be a feeling of no progress, deadlock is there, or the client becoming indifferent. They don't want to change or they don't want to work through. In such situation, the counselor has to use immediacy where they can focus on their feeling experienced by the client and the counselor at the present moment. It conveys genuineness. I have tried enough and now I feel that you are not ready to work. Is it so? You have to show your genuineness that yes, I'm really concerned, but you are not working right now. So I feel helpless right now. So immediacy is sharing your feeling and client's feeling at that particular moment and tries to refocus on the goals of counseling. That we started the counseling to resolve this particular issue, but it seems you are not working on your homework which is given, and that makes me worry. So when you share and when you bring the client in present, that is called immediacy, skill of immediacy. Then we have confrontation. Usually immediacy, confrontation, we do not use in initial session of counseling. That is where we build the trust, acceptance and positive regard. Usually confrontation, clarification, reflection and all things should happen in the middle phase of the counseling. So the counselor sometimes need to comfort the client regarding his or her potentials, differences, discrepancies or distortion in his or her behavior. So, for example, if the client is saying, I don't want to work with my father, you know, then immediately you can confront. But in last session, you were saying that you are ready to work with anyone, and that includes your father. Right now, you are using that, so I find discrepancy. But today, you are saying you don't want to work with him. So you can confront so that, and that will challenge the client and encourage him or her to see things from a different angle. So confrontation will make him clear why he or her using defense mechanism and where is the discrepancy. Then questioning is a very important skill in the counseling. So we need to. There are a number of questioning skills, and there are a number of questioning techniques. So we are here. We are only discussing about open-ended questions and close-ended questions. But we have leading questions. We have threatening questions. We have like questions, funneling questions. So this I will give you a little brief about all type of questioning. So in counseling, mostly we focus on open-ended questions. Open-ended questions are those which allow the client to elaborate and explain the feelings and their things, whereas close-ended questions elicit single-word responses. If I ask, "Did you eat food?" you will either say yes or no. So it does not elicit any elaborate response. So instead of saying, "Did you eat food?" I would say, "What did you eat in the lunch?" So they'll say, "No, I did not eat." Okay, can you explain why did not you eat? So when you ask the open-ended question, you will have better answers or you will have elaborative and expanding answers from the client. Use more open-ended questions which help the client to open up and express her or his thoughts in an elaborate way or in a better way. Counselors need to make an appropriate use of both open-ended and close-ended. Not always that it does not mean that close-ended question only elicit what is your name? You'll say my name is so and so. But there are important to get the demographic information. You may require close-ended question, but if you are exploring the thoughts and feelings of the client, you require open-ended question. And suppose if sometimes we do not have the leading questions in counseling, like it seems you should do this, or don't you think you should choose this particular option? So this is leading question. So we do not do the leading question, and threatening question asking something which is very private or very the person feels uncomfortable with, especially in the initial session. So counselor needs to make an appropriate use of questioning skill and should know in which context and requirement which kind of question is important, and that can be practiced. Questioning can be practiced. So, beside the above counseling skills, the success of any counseling or therapeutic relationship between the client and the counselor or therapist depends on two main things. Number one is the personal qualities of the counselor and professional qualities of the counselor. Till now, we have discussed what are the core conditions of the counseling and what are the basic counseling skills. Apart from these core condition and basic counseling skills of counselors, personal qualities and professional qualities of the counselor also does impact the therapeutic relationship. So let's see in personal qualities of the counselor what will all come. So having a positive mental health, being open minded what the client is sharing without judgment when you are listening, and being open minded, being genuinely concerned for fellow human beings, having the caring and understanding attitude, being sensitive to the context and different religions, regions, and different differences, and have critical thinking. These are personal qualities of counselor which will help them to become better therapist or counselor. Being aware about self. If you are not aware about your qualities or your difficulties, your emotional trigger, your biases, how can you help others? So, in order to heal others, you need to heal yourself. In order to create awareness in the client, first you need to be aware about your positive and your negatives, your strength and your limitations. So, self awareness, awareness about others, understanding others are important personal qualities that help one to become an effective counselor or therapist. Clarity about their own attitude and their own motives, beliefs, and values is very important. Many of the times, the counselors, especially who are coming in the counseling session, they have very negative attitude, which can impact your judgment or your attitude towards certain things can influence the choices of the client. So you need to have clarity and awareness about your own biases towards the client or in general. Helping attitude with sensitivity and empathy makes for the base of an effective counselor or therapist, and sense of warmth and genuineness in helping others. So these are some of the personal qualities of the counselor or therapist which every therapist should have, and that make them a better therapeutic relationship. They can create better relationship and they can have better counseling process. Then, professional qualities of a counselor or therapist. Number one is proper education and training. Everyone who is coming in the field of counseling, they should have a basic of psychology, that is masters in psychology, and then they should have some skill based course, advanced diploma in guidance in counseling or diploma in guidance in counseling, where the skills are taught, because counseling is a skill based profession. So proper education and training, learning the skills and competencies under some supervision and guidance, adhering to the counseling code of ethics. Every profession has ethics. Ethics are the common code of conduct which a person should do. Proper academic training in counseling theory and skills is essential to be called as counselors. But in general, there is a very misconception. Academic counselors are there. People who sit on the reception call people for admission. They call themselves counselor. Visa counselor, where you are going for visa and having the discussion. So there are lots of misconception about counseling. So in order to become a psychological counselor or therapist, you need to have, number one, your master's in psychology and at least 1 year diploma in guidance and counseling, which is skill and competency based, and follow ethical guidelines which need to be followed to ensure professional conduct during the process of counseling. So if a person is having create the core condition for counseling with the help of basic counseling skill, and a person who is having good personal and professional qualities, definitely any counseling therapy, the success rate of counseling improves. The therapeutic process becomes better and the healing becomes better. So I would like to end the session with the beautiful quote by Galileo: we cannot teach people anything. We can only help them discover it within themselves. And that's why counseling is not preaching. Counseling is not giving advice. Counseling is basically reflecting and mirroring so that the client get the clarity what they have to choose. So we help the client to help themselves. We help the person to discover what is there within and make a better choices. And now, success as a therapist is not found in doing something but for the client, but rather in being someone for the client. So when we say being someone for the client, your personal and professional qualities and your core conditions and the skills that make you being someone for the client, and definitely you will be a better successful counselor and therapist. Wishing you the best. Thank you.